Welcome to this video, and in this segment I'm going to focus on the UK and a few other countries where there's interesting, noteworthy things happening around the world. Now, starting off with the UK, a little detail on the UK today. The Leicester lockdown. So basically this rolling lockdown or regional or smart lockdown or whatever you want to call it is being instigated in the UK. And Leicester, because it was developing into a bit of an epicentre, has basically been closed down again, as things were for everyone else just a month or two back. So Leicester's got an increased lockdown. Now, what I would really like to see in Leicester is a phylogenetic analysis of the outbreak. Now, what do we mean by this? Well, phylogenetics is basically the study of evolutionary genetic change. So since this virus first spilled over from an animal reservoir into humans, we still don't know quite how that happened actually. Virologists are basically sure this came from bats, but they don't know anything else than that for certain yet. So let's hope the Chinese authorities open up on that fairly soon. But anyway, I get distracted. Phylogenetic analysis is looking at the changes in the ribonucleic acid, the RNA, that is the genetic material of this virus. So your genetic material is DNA, deoxyribonucleic acid. For the Corona-19 virus, it's RNA, a single-stranded ribonucleic acid. And that mutates quite regularly. It doesn't mutate in huge ways. It doesn't seem to have mutated in ways which have increased the virulence, but it does mutate, and that allows us to work out various sort of what geneticists call clades, the way it's distributed around the world, where a particular virus has come from. And in the Leicester one, there doesn't seem to be any phylogenetic analysis, because my suspicion is that this is an imported cluster from overseas. Because there's a lot of flights, up to 2 flights a day have still been going back and forth from Pakistan, which probably has got a lot more cases than the Pakistani government realises or is prepared to admit. Now, if that's the case, that's got implications because that aspect of travel would need to be temporarily closed down. So you hear nothing about phylogenetic analysis in the UK, which is a pity. Now, later on, we'll be looking at Australia, and Australia are going flat out on phylogenetic analysis to work out where particular outbreaks came from. Pity we're not doing that. Now, another area where there's increasing cases is Brent in West London. Now, 2 factors there. I watched some video from Brent on the BBC, and on the street there was very poor social distancing. People seemed to be sitting around having chats. Very nice to sit around and have chats, but there didn't seem to be the social distancing and there didn't seem to be the mask wearing. So if we're not going to respect social distancing and mask wearing, we can expect to have spread of the virus. And this seems to be the case in Brent. And also in Brent, there's a relatively large proportion of the population of Somali origin. And of course, Somalis are going to make vitamin D, native Somalis are going to make vitamin D much more slowly than, say, I will, because I'm lighter coloured. Now, I know what you're thinking. Hasn't the NICE guidelines just debunked the vitamin D thing altogether? More on that, I'm working on that. I still think this is a factor. So 2 factors there potentially in Brent that we could be thinking about to reduce the spread of this virus. Now, another thing that struck me about the UK is if you're in politics and you're a politician, then you can ignore social distancing. It doesn't apply to you. It only applies to us, the ordinary riffraff. So if you're Deputy First Minister of Northern Ireland and you want to go to a funeral, then that's fine. You can ignore social distancing. All the other people who have been tortured by the fact that they have not been able to attend the relatives of their parents and loved ones in Northern Ireland, that doesn't matter. You're just riffraff. You're not a senior politician. I think you get my point. Senior politicians must lead by example. To go to a funeral where it's reported there's 200 people inside and thousands of people outside, while telling others you can't go to funerals, it gives this message loud and clear. Listen, you lot. Do as I say, not as I do. Leaders must lead by example. On the previous video, I appealed personally, not that he listens, but I appealed personally to Donald Trump, the president, to wear a mask, to lead by example. Political leaders must lead by example, and this was simply unacceptable. So I can't remember a name now, but if you're watching, I consider your behaviour unacceptable. You must lead by example. Office for National Statistics. 14th to the 27th of June for when the data is in. England, 25,000 infections of COVID-19 at any given time. Greatly reduced on what it was. And this equates to 1 in 2,200 of the population. Now, this is a very encouraging reduction. Let's hope this keeps up. And it does. It seems to be levelling out at the moment, but the overall trend is still good. More on why that might change in a minute. But the tracker app, the Tim Spector's Zoe app, which I fill out every day, of course, indicates 1,445 new cases per day across the UK. That's through all of the UK. Not too inconsistent with the Office for National Statistics data, to be fair. But this is the Office for National Statistics. The Office for National Statistics. The decrease in numbers of people in England testing positive for the coronavirus is continuing to level off. So it's still going down, but it's not going down as steeply. That's the message. It's still going down, but it's not going down as steeply as it was. But it is still reducing, which is excellent. And we'll see a bit more on that now in a minute. Now, this is fascinating. I have been umming and ahhing about this because there seems to be differential scientific advice and data on this. And it's related to flu vaccine. Now, initially, way back in January, February, I had lots of questions on this. Will the flu vaccine protect me from COVID-19? Now, the answer is absolutely not, because the flu virus protects you against an influenza virus and COVID-19 is a coronavirus. So there will be no direct enhancement of your immunity. You will not be given acquired specific immunity to coronavirus as a result of being vaccinated against the influenza flu virus. So the answer to that question is no, it won't give you any direct protection. Then the next thing to ask was, does it give you indirect protection? And the answer to that is probably yes, because if you get influenza and COVID-19 at the same time, I haven't got a full data set on this, but that's probably something you really want to avoid. That increases the chances of more severe disease and potentially fatal disease. Can't give you quantitative analysis of that now, but it's certainly the case you'll want to avoid both. So it seemed back then that having flu vaccine was a remarkably good idea. Then some data came out showing that people with flu vaccine might get more severe COVID-19 because of some enhanced immunological effect. But I haven't read anything else on that lately, but it seems like the government is assuming that that is not the case. And it seems that the government is assuming that to have the flu vaccine is a good idea. And it doesn't seem to be worried about this potentially enhanced immunological effect. So it seems like that's not an effect from the government, current government thinking. So what they are saying is that looks like we're going to go flat out for flu vaccination this season. And of course the flu vaccination season will start shortly. So the government is seeking significant additional supplies. Basically it seems to be trying to get as much as the flu vaccine as it can. Now, normally we give flu vaccine to people that are pregnant, NHS staff and care workers. I used to get it from occupational health every year. They used to give me a shot every year. It was very convenient. They were the people that used to get it. Pregnancy, NHS workers, care workers, over 65s, primary school children, and people with particular high risk. Now, it looks like Keir Starmer, the leader of the opposition, has called for flu vaccines for all over 50s. And of course, that means you need one heck of a lot extra doses. So let's hope that they are made available. And this is all assuming that the government seems to have decided that it is safe to give flu vaccine. And I haven't analysed the data myself, but if that's what they're saying, well, that's fine. They're basing national policy on that, and it sounds good to me. I will take a look at it as soon as I get the time. There's a few things on my things to take a look at, but SAGE, the Scientific Advisory Group for Emergencies, said way back in the 30th of April that the government should give consideration if they should be vaccinating the entire UK population against flu, against influenza, because we don't want people catching influenza and COVID-19 at the same time. Now, still only a very small minority of the population of the UK has had coronavirus infection, has had COVID-19, 5 to 10% perhaps. So 90% of us are still at risk of getting it. And that means that the number of cases still going to be carrying on with community spread. It's not going to go away. And I fear that the cases are going to go up at the start of winter, which is, of course, exactly the time that influenza normally kicks in anyway. So SAGE is saying here, consider vaccinating the whole population. They don't seem to be worried that it's a problem. So fair enough. So it looks like we're going to be giving out a lot of flu vax this flu season. We won't be able to give out Corona-19 vaccines because we won't have one, I don't think. But we can certainly protect against flu and stop this double whammy of flu and influenza. And of course, the other thing is that the clinical features of flu are very similar to those of COVID-19. So people, for example, with respiratory features or with a fever, they would have to self-isolate for 14 days in case they had COVID-19. So as well as the double whammy of people getting sick and dying because they have both infections at the same time, if we can greatly reduce the amount of influenza, then we can save this diagnostic confusion, which otherwise would be inevitable. Now, the R value in the UK is estimated at the moment to be 0.7 to 0.8. So as the UK as a whole, there's no question that cases are going down. For England, it could well be that the rate is the same, but the estimates there are wider. Are slightly higher, 0.8 to 0.9. So as you know, if it's 0.8, R equals 0.8. Every infected person on average infects 0.8 of another person. Or to put it another way, 10 infected people will only infect 8 new people. Therefore, the number of cases is going to go down. And that gives us a current growth rate for the UK at the moment of minus 0.8 to 0.9. So it's going down very gradually at the moment. But as we've just noted from the Office for National Statistics, the rate of decline is not as steep as it was. Still going down, but not as steep as it was. Now, part of the reason it's been going down, as well as behaviour, is the test and trace strategy. The test and trace strategy. So here, people are tested and then all their contacts are identified, traced, and their contacts are then advised to self-isolate for 14 days. May the 28th to the 24th of June, test and trace. Now, during this time, the government said that 27,000 people who tested positive in England. Just over 20,000 of those were reached and asked to provide details of recent contacts. So, sounds good. And if these self-quarantine and identify their contacts, can greatly reduce the rate of transmission, no question about that. Because not only will they be going on to infect a second person, a third person, a fourth person, a fifth person, because they're self-quarantining now, they're self-isolating now, their contacts who could be asymptomatically and pre-symptomatically spreading the disease will also be self-isolated for 14 days. But of course, this also means that well over 6,000 were not reached, therefore could potentially go on spreading it themselves, and the people that they were in contact with may not know that they've developed it either, and they can go on spreading it. So is that successful? 74%? I would have thought could do better is the answer to that. And of course, the reason partly we're not doing better is the app in the UK has been totally botched up, basically. Now, the app apparently now that we're getting in the UK is based on the German model. So it looks like we're pinching the Germans' app, which is fine. Let's put that in a more accurate way. The British and German authorities are currently cooperating and collaborating together, which is true. They are working on it together. Now, however, despite these gaps, from these people, from this 20,000 here that were identified, from this 20,039 people that were identified, of those people, so of those 20-odd thousand there that were identified, they identified 153,000 contacts. So we can see there that each of those people had an average of 5, 6, 7 or 8 contacts each, and they were able to isolate those contacts, or advise those contacts to isolate. So this just shows, you know, so these 20,000 people here who tested positive identified 153,000 contacts. As we say, that's 5, 6, 7 or 8 contacts per person who would have gone on spreading the disease potentially, at least until they became symptomatic, potentially quite dramatically. But because of the test and trace scheme, that number of infectious people or potentially infectious people were taken out of circulation for this period of time. So that's actually, they were the contacts identified, sorry. Of those, 132,000 were reached and asked to self-isolate. Right, so that's how many there were identified. That's the number identified. That's the number that were actually reached. So there was 153,000 identified, 132,000 actually reached. But that's still, of course, a big reduction. Now, the splash news of the day, pubs. Opening 6 o'clock in the morning on Saturday. Now, personally, I don't normally start drinking till about 6:30, so I won't be there at 6 o'clock. But the pubs are opening. Now, the pubs are opening, but the gyms are not. Of course, the pubs have got a lot of restrictions. We'll look at some of those. But I think this, strangely enough, could be the right way to go about it, because in a gym, very often you're indoors, and by definition in a gym you're going to be puffing and panting because you're exercising and working out and stuff, and the hyperventilation is going to greatly increase the aerosolization of the virus. So gyms, by virtue of the fact that people are breathing heavy and hard, are intrinsically a high-risk environment, especially if they're poorly ventilated. Exercising outdoors, absolutely fine, of course, as long as you're socially distanced, because the virus is diluted. But indoors, it's a different thing. Now, on the previous video, I talked about the warm weather in the United States, perhaps being a good thing because it was keeping people in. And because I don't live in a particularly hot environment, people from the States are writing in saying, oh, no, you're wrong. This means that people put the aircon on. And obviously, you're right, I failed to consider that. So in the United States, because it's hot, people are actually closing the doors and putting the aircon on. And in multi-occupancy buildings, that's going to circulate the air around, so that could actually cause more spread. Diamond Princess comes to mind, of course, from the Yokohama debacle in Japan way back at the start of this pandemic. So aircon in your own home is one thing, but aircon in an office building, for example, where there could be 50 people in the building, if the air's circulating in the aircon, then that's actually quite a high-risk strategy. So the hot weather could actually be resulting in more spread potentially. So that's via the aircon. So thank you for people sending that in. I appreciate that. It's an obvious point when you think about it. Now, Southern Ireland, Republic of Ireland, we call it Southern Ireland, but Republic of Ireland, the independent part of Ireland, they're reopening their pubs in the Republic of Ireland. Or they have reopened them. I'm not quite sure when, a day or two back. But you have to book a table. You have to restrict the group that you are drinking with to 4. You have to sanitize your hands on the way in. It's serviced, so you can't go to the bar. You are not allowed to sing, so no singing because of the increased aerosolization. And you're allowed to stay there for some reason for 105 minutes. So they're the regulations in the Republic of Ireland on going to pubs. And to tell you the truth, I'm not sure about that one. In the UK, in England anyway, at the moment, there's going to be no time restrictions. You can sit there drinking all day if you want. But in the Republic of Ireland, 105 minutes. And I must say, these all make perfect sense. What we don't want is people shouting. Because when you're shouting, you are aerosolizing much more than if you're just talking quietly. And if you're singing, I'm not going to illustrate that one, but if you're singing, then obviously you're giving out a lot of things. That's why it's one of the reasons we can't have some religious services because of singing. So this is all happening on England. This is England on the 4th of July, Saturday, probably today for a lot of you watching. Independence Day, of course. Delighted that our American brothers and sisters liberated themselves from colonial oppression on the 4th of July. In England, it's been called Super Saturday. Bit of a silly name, really. First time the pubs have been open since the 23rd of March. Northern Ireland, the pubs opened already. So they're already open. So people have been drinking in pubs in Northern Ireland all day Friday. So with the regulations that are in place, and if there's good ventilation, that's the key thing here. All these regulations are good. So the waiter / waitress service, that you don't crowd round the bar, good. The social distancing, good. All those things good for bars and restaurants. Mask wearing, of course, is difficult when you're drinking or eating. But the key thing that's not mentioned in the official guidelines is how well it's ventilated. So in summer, just open all the doors and have a breeze blowing through the pub, and it's going to be, let's make up a number, 10 times safer than if all the doors are shut, 20 times safer, 30 times safer than if all the doors are shut. If there's good ventilation, that's the key thing. So if you're drinking, make sure the establishment has open windows and doors, plenty of through draft. Now, A&E doctors have pleaded with drinkers not to get plastered. And Boris Johnson has asked people to... Now, if you're American, plastered is another form for alcohol-based inebriation or intoxication, referring to drunkenness. Now, this is quite a common recognised problem in A&E. In A&E, you might be getting a report and... whoever's handing over to you say, well, John Smith's in cubicle 2, fractured tib and fib, PFO, because his diagnosis is PFO. Now, that stands for, the FO stands for fell over. P fell over. Can't remember what the P stands for now, but anyway, that's what that diagnosis is called. And it's relatively common in accident and emergency departments. And indeed, you get a lot of PFOs admitted early on the morning, especially on Saturday morning, Sunday morning, when people are out drinking the night before, because remember, you only excrete one unit of alcohol per hour, and if you have many units of alcohol, it can still be in the blood the next morning. So it's not uncommon that we get accidents due to people falling over when they're drunk as well, but also the next day, and road traffic accidents indeed the next day, which can be, of course, very, very serious. So let's try and minimise the diagnosis of PFO if we possibly can with moderate drinking. England quarantine. Now, yeah, this is interesting. So airline industry and, of course, all the travel industry is kicking off. So England has now come to reciprocal agreements with Spain, Italy, France, Germany, that if people go to Spain, Italy, France or Germany, when they come back to the UK, they will not need to quarantine for 14 days. And of course, this makes actually holidays possible again. Now, a full list of countries has been published, and I will show it to you briefly now. And of course, I'll paste it into the... so, get the right screen. There we go. So this is the full list of countries which people can go to England. If people returning to England, not necessarily for the same for Scotland at the moment, but people returning to England from these countries will not need to quarantine. So these are all obviously countries which are chosen for their relatively low rates of disease. Those ones and these ones. As I say, I will put these in the links below. So all those countries we're not expecting, well, there won't be quarantine. Plus some British overseas territories. Now there's insurance issues here. If someone is booked to fly away and then they develop COVID-19 symptoms, of course they will not be allowed to board the aircraft or the ferry or whatever it is. And it's likely that the insurance companies will make this an excluded cause. So your travel insurance will say if you get sick when you're due to go on your flight or whatever, tough dead, it's your fault, you pay yourself. So people will be probably excluded from insurance. So the person booking the flight or the holiday is going to be taking their own risk on that. Now, the downside of that is, and this is my concern, is that if people have just paid £500 for a flight and then they don't feel quite right that day, they'll think, oh, I'll give myself the benefit of the doubt, it was £500, that's a lot of money. Because they would lose it otherwise, you see, because the insurance, I don't think, will cover it. So that may mean that we get people flying when they are infectious. That's the risk. Anyway, let's hope everyone is responsible and that doesn't happen. Now, in terms of the United States, of course, unfortunately, at the moment, the quarantine will still have to apply because of the widespread nature of the disease in the United States at the moment, as we looked at in detail on the last video. Do catch that one if you missed it. Now, Philippines. Philippines, largest single day increase of cases. Still relatively low numbers. The Philippines, of course, had a very severe, really draconian lockdown. But the numbers do now seem to be increasing. And once they start increasing in the Philippines, there really could be a serious exponential growth because, in other words, the acceleration in cases will accelerate. There'll be an acceleration of the acceleration. And due to social conditions there and housing conditions, especially in the cities, thinking about Manila, for example, rapid spread there becomes possible, unfortunately. So that's why I wanted to mention that one. Now, the Netherlands, another mink farm is infected. That's now 18 mink farms. So the mink showed symptoms. In this other farm, now there's 18 farms have been infected. Mink farms have been infected. So the mink can get the disease. And 2 workers have been infected from the mink. And the World Health Organization has said this is the first known animal to human transmission. So we know that domestic cats have got it, and even some dogs have tested a bit positive, weakly positive. But there's been no cases of people catching it from their domestic pets. Of course, the initial infection came from animals, from bats via some other animal we don't yet know. So it happened in the first time, but this is the first time since the pandemic has been going on that animals have infected humans. 2 humans have been infected from mink. Now, of course, that means all these mink are going to be killed, as indeed all the mink on all these other 18 farms have all been culled. They've killed a lot of them. And really, you know, to me, this is just an indication of really why we're in this position. The human attitude to animals, and farming mink for coats, when we can make synthetic fabrics that are probably warmer than, I don't know if they're warmer, but we can certainly make perfectly effective synthetic fabrics for very low cost. You know, that we need to farm mink for their furs at the moment just seems ridiculous to me, and it's indicative of an attitude problem. an attitude problem that humans have got towards animals. We need to think about the way we are interacting with animals on a much, much more humane basis. Even if it's only out of vested self-interest, that we don't want another one of these zoonotic pandemics which we are currently enduring. And this is a zoonotic pandemic. This virus came from via animals. There is no question about that. Now, South Africa. Another area of concern, increasing cases, increasing deaths. Now, the South African authorities have predicted 40 to 70,000 deaths before the end of 2020. At the moment, it's 2,844. Let's hope they're wrong. Now, I get accused of fear-mongering every day. No, let's rephrase that. I get accused of fear-mongering perhaps a couple of hundred times a day. But unfortunately, quite a few of my predictions have come about because I try and work out what's going to happen based on my understanding of human beings and the transmission characteristics of this virus. And I fear giving... I've never been to South Africa, but I have studied the situation there and talked to a lot of people that have been there. I fear that this could be an underestimate, if anything. Let's hope I'm wrong. Part of the reason I fear that is the health authorities there are already under strain, and people that could have survived with good healthcare, as we've said repeatedly, as we looked at a couple of days ago on this video when we were talking about Iraq and other countries, that this is going to be a problem. Right, so South Africa is reopening, cases are increasing, hospitals are already struggling, and Joburg is considering reimposing some restrictions. Considering. Not quite there yet. So the increasing spread in South Africa I would expect to accelerate, and I would expect the death rate to be higher than it could have been due to many people not being able to access the healthcare that could be life-saving. As indeed will be a problem in many places in Africa, I fear. Mexico is another one. Again, very challenged healthcare infrastructure. Cases in Arizona just across the border are rising, and the Mexican authorities are considering a border closure. I don't think it's going to happen. So a lot of people from Arizona might go for Mexico for the 4th of July holiday. A lot of people in Arizona have got COVID-19. They're going to carry a lot of COVID-19 to Mexico, a country that is not well equipped to handle it. There's going to be screening of incoming visitors from the United States, and that screening is going to consist of taking their temperature and asking them about symptoms. Clearly, grossly inadequate. So I fear there will be an influx of COVID-19 infection from Arizona into Mexico today in the next couple of days. I fear that is the case because the border's not going to be closed from what I understand. Now this is interesting. Australia, 66 new cases in Victoria, 28 further cases under investigation, and most of these seem to be linked to a super spreader. Now a super spreader is one person who, due to biological factors that they put out huge amounts of the virus, or due to social factors that they interact with a lot of people, or perhaps they're in a public-facing activity, for a combination of social and medical and biological reasons end up infecting a lot of people. These are super spreaders, and it looks like there's been a super spreader at loose in Victoria in Australia. Now, Victorian Health Minister Jenny McKeetos says this: I sought some explanation. I wanted to know what had gone wrong. Good. Genomic sequencing reports that seem to suggest there seems to be a single source of infection. Now, what was I just saying about the genomic sequencing we don't seem to be doing in the UK? They are doing in Australia. Excellent. This is proper public health surveillance. So they've done genomic sequencing, and all these people that are infected, or the majority of these people that are infected, have got the same phylogenetic type of ribonucleic acid in the virus. Therefore, they all probably come from one common source, indicating the likelihood of a super spreader. Now, they haven't caught him yet, or her yet, but that's what they're working on based on the phylogenetics. So this is very good. This is very good public health. The phylogenetics of the virus, so the clever boffins who work out the precise sequence of the RNA in the lab, are able to inform the public health authorities, who can then use that to trace the specific chains of transmission for this, what appears to be a single viral strain. And also pleased to see that further genomic sequencing is underway. So the Australians can manage it. It appears that us Brits in the old country can't quite seem to manage that. Pity. We should be doing more phylogenetic analysis too. It's an extra tool in our armoury of public health control. So things in the UK are going down at the moment. The rate of decrease is decreasing. The line is not going down as fast as we could. But with these increasing liberations and lifting of lockdowns, I predict there will be more infections. I hope I'm wrong. I don't think it's going to be allowed to rise up into a second spike. I think it's going to more bumble along. So I wouldn't be surprised if the number of new cases a day goes up to 5,000 or 10,000 a day. I wouldn't be surprised if that happens. But the way things are at the moment, the health service can probably cope with that. It does mean more people are going to be sick. It does mean there's going to be more deaths. But I completely accept the economic argument that we can't stay closed down forever, and the social argument. Okay, so that's an update on my current thinking on that situation. Do let me know what you think, as always. I'm sure you will.